Welcome to the Human Together podcast. I'm your host, Dr. Jason Floyd. Human Together is a show that is centered on humanity to create understanding and appreciation for individuals and groups that are both informative and thought-provoking.
Today, I'm honored to be joined by Sara Brickey, the Executive Director of Valir Pace, who's also the recipient of the 2017 Oklahoma Hospitals Association Spirit of Resilience Award, and also she's the 2019 National PACE Nurse of the Year. Welcome to the Human Together podcast.
Thank you, Jason.
Let me start here. What is Valir Pace and what services do they provide?
Sure. Valir PACE stands for Program for All-Inclusive Care of the Elderly. We provide medical services such as nursing providers. We have a full clinic there at PACE. We provide therapy services such as PT, OT, speech therapy. We also have a relationship with the MAPS project. So we also send our participants that qualify to the Healthy Living Program, Pete White, so that they can exercise in the community. We have certified home health aides that do visits to the home, help provide housekeeping, also assist with shopping and groceries, maybe some meal prep for them if they need it. We have social services. We have counseling available. We have a registered dietitian. And we provide meals, and we have a meal program for those participants that need assistance with that. We have an activities program where we try and keep them engaged, have a culture of wellness, bring them to the adult day center if needed. Not all of them come to the day center, but if that is a need that the family or the participant needs, then they can come to the day center as well.
And where's the day center located at?
We are at Northwest 6th and Chartel, and right across from the Valir Rehab Hospital, 721 Northwest 6th Street.
Now, is this a national model, or are you just in Oklahoma City?
It is a national model. They are across the United States. We are only in Oklahoma City. There is another PACE program in Tulsa, and there is one in the Tahlequah area as well.
And how long has PACE existed?
We just had our 5-year anniversary. We have been here in the Oklahoma City area for 5 years with Valir Pace. But the actual PACE program has been cooperating with CMS and the Medicaid system since the 1970s.
You guys provide some unique services for the elderly. You've got a lot going on, a lot of great things. During the coronavirus, the elderly are a vulnerable population. What steps do elderly people need to take to protect themselves?
Well, we are encouraging them to stay self-isolated as much as they can in their home, to use the social isolation of staying away from people, using the 6 feet standard, as well as hand washing, make sure that they wash their hands every time that they get a chance, and make sure that they do it for at least 20 seconds. Use hand sanitizer as well. And then also just use any household cleaner that they have for any high-touch surfaces that they may have in their home or in their areas.
Have the shutdowns caused by the coronavirus affected the way you provide services? If so, how?
We right now do not have participants coming to the day center. We are coming to them. We have decentralized our care. We're into more of a home-based care right now. We still have providers that are making visits, but we're going to them and not bringing them to us at the clinic. We have nurses and we have other healthcare professionals in the field. The aides are still going out, helping with visits and checking with them for their needs, for groceries, not just also their mental health as well. Social work department is calling and checking on them, giving them some coping skills and things to decrease their anxiety. So we are still very much caring for them and checking on their needs and seeing what is needed for them.
You kind of touched upon this earlier. Beyond the health services you provide for the elderly, Valir Pace offers some social programs. What activities does Valir Pace offer as far as social programs?
When we're not in coronavirus mode, we have the day center, we have Tai Chi, we have brain teasers, we do meditation, mindfulness, we have emotional wellness group, we have grief and loss group, we have chaplains that come, and that's going on. With what's going on now, we are focusing on trying to still provide those things, so we're trying to utilize technology to do so. So we will be doing it by teleconference. So we've sent out phone numbers and an activities calendar to them for different times that they can call in. If they have access to Wi-Fi and technology and tablets or such, then they can also log in. So they'll have nutrition classes. We will still have our emotional wellness group. We will have a chaplain for 15 minutes of prayer a day. We will have meditation. They will have group exercise. So we are still trying to have them have activities in the home while we're going through this.
Beyond the coronavirus experiencing now, and it's definitely affected your schedule, what are some future events or programs Valir Pace will offer?
We are really growing. It was just recently that we were approved to expand the service area of the seniors that we could help. We have expanded into many more counties and different towns, and so we will be able to expand how many seniors we're able to help and sign up for the program.
Lastly, how does someone, elderly person, sign up for the services or find out more about Valir Pace?
Sure. They can just go online to valorpace.org and they can look into the services that we provide, and there's contact information there. They can also just call us at 405-609-3688, and they will be glad to speak with them and see if they qualify for our services. There's also a place for a donate button as well, because we are working on making care packages for seniors in the community to try and help with the need of paper goods, canned goods, activities, cards, coloring books. So we have that going on right now as well, too.
That's awesome. Are there any cost to individuals, or is it through their insurance, or how does it work once they sign up?
If they qualify for our program, which is through, they have to be 55 or older and qualified financially, then that will decide if they qualify for the PACE program.
That's great. Anything else words of advice that you need to get out, not just for elderly, being a nurse, things that people need to be aware of for the coronavirus?
We would just really appreciate everyone partaking in the social isolation and the 6 feet apart and just washing your hands. Check on your neighbor, write them a note, give them a call. Check on the seniors. They don't want to get out. They understand that they're at a higher risk, so they may need help with things at the grocery store, making a grocery run. So check on your community, check on your neighbors.
That's certainly great advice. Sarah, I appreciate you taking the time to visit with me today, and you've given some good information, and I wish you well for Valir Pace in the future, and stay safe.
All right. Thank you so much.
I appreciate and want to thank nurses and healthcare workers who are on the front line of the coronavirus pandemic, along with grocery store workers, people in the restaurant industry, our firemen and women, and police officers, amongst others, who are playing a vital role in maintaining life and dignity during these times. And despite COVID-19, they are all helping us to become human together.